with going after all residents, but we had a mission to go after, a large percentage of folks that are underserved, attended to. So that meant really paying attention to all the ethnic groups that were involved, and then 18 to 65 and 65 plus. Those were the demos. I think the county did a lot of outreach. Our role was to obviously provide an air game, and for that purpose, we didn't have a lot of advertising dollars. What we did was took advantage of using earned media, as well as everything from lit, as well as doing online with digital advertising to a certain degree, and social media. But it was that earned media that we were able to take advantage of that gave us a lot of horsepower, because we're in a major media market, and because of the subject matter, we were able to develop some very good relationships with the 4 primary broadcasters in the market, and particularly ABC became a real starship for us, because they were keenly interested in what we were doing in Kane County, and as a result, we were able to use their voice, so to speak, to carry our message.
Can I just say real fast on this one, Randy?
Yeah.
One thing that we struggle with internally, and maybe this is something you see with clients or others you work with, in public health, we like to think that everybody is our audience, and that makes our messaging almost impossible. So as we're talking here about how we can really segment who our population is, now with this whole vaccine rollout, it created unique challenges, and it's 2021. People are much more aware of race and equity, and that's a big discussion. Certainly it's something that's always been a part of public health, but everywhere that conversation's dramatically increased. When the vaccine was hard to get, the people who were tech savvy and had time to get on the Walgreens website at 6 in the morning and see if they could get an appointment, those were the people who were getting shots. So as a result of that, we were seeing tremendously unequal distribution, where people at very low risk of exposure were getting vaccine sooner than people who were in potentially high-risk jobs, because they weren't able to get to the system to sign up quickly enough. So there was, can you go back one? If we'll test our skills here as we're going on this. That's good. On the left there, we set something up where through our kind of flagship site where everybody could go, we also started to set aside shots that people would not be able to access, they would not be able to make appointments for, but rather we work with specific organizations that may work with seniors who maybe have technology issues, or may work with non-English speaking clients, and we'd say, okay, today 500 doses are going to go to your organization, you work with people, and you can sign them up. So even though we were doing our larger communications campaign, we were also able to start segmenting so we could get a little bit more equitable distribution.
I'm going to try to see if we can. We've got this embedded here, using a different system. No.
The far western suburbs are preparing to expand vaccination eligibility to more people. The Kane County Health Department is making that announcement exclusively right here, right now, on Eyewitness News at 11. We're joined this morning by Corinne Pirog, the chair of the Kane County Board, and Michael Isaacson with the Kane County Health Department. Thank you so much, both of you, for joining us. Corinne, if I may start with you, let's talk about this announcement. This is so important. Who are you expanding the vaccines to, and where and when is this happening?
Well, thank you, and we're just so excited. The good news is that we're going to be opening it up on March 19th, which is Friday. 2 weeks, we've got a quick turnaround, and it is going to be a lovely site, able to hold 10,000 people if needed for vaccinations. Right now, we are looking at continuing the requirements set forth by the CDC. But then on May 1st, we're going to be able to open it up to our entire population of eligible adults to be able to get the vaccination. Our population reach is about 440,000 people. So we're going to make sure that every door is going to be knocked, and everybody who would like to have a shot is going to be able to have one. It's going to be accessible and available. And the site is going to be opened up 6 days a week from 8 a.m. to 8 p.m. By appointment. And we'll make sure that we have a call center that's going to be available, which will be available starting midweek, so that everybody can make their appointments. And the appointments will be available, call center bilingual, so there's not going to be any hesitation or restriction, no matter who you may be, to have fully accessible site vaccination.
This is such exciting news. And Michael, you say that over 60% of Kane County seniors have gotten one dose at least. Now, how does that line up with your surrounding counties?
Sure. Thank you, and good morning. Thank you for having us on. We're just a little bit above average in terms of getting vaccine to our senior population. So we're over the state average, and this is because we've really paid special attention to trying to reach those people who've been most impacted by COVID. So over the past several months, we've worked very carefully, not only with the federal and the state government, but also with our local partners. We have made vaccine available at over 50 locations in Kane County. And as Madam Chair just announced, we're excited to bring a stable, consistent site where our residents know they can go. But we're going to continue to put a special emphasis on making sure that we're reaching the populations where they are as well. So just a quick example with the senior population, we identified very quickly that many seniors struggled with the technology that was required to be able to register to get appointments. So we had 15 agencies in our community that stepped forward and said that they would help us register people by telephone. So for people here in Kane County, they can call 211 and get information about how they can reach one of those organizations. And then we have been putting specific appointments aside just for those seniors who may have technological issues. That's an example of how we've reached the senior population. As we move forward, we want to make sure that we're continuing to do things to reach other people who've been most impacted by this disease, including working with our manufacturing plants and our factories, and getting into neighborhoods where transportation and language may be a barrier.
I'm so happy that you've made it easier for our elderly population. One more question, Corey, before we go. I want to just check in with you and ask about schools. How are the schools doing, and what's the feedback been for in-person learning?
Well, as a former educator and a former member of the St. Charles D303 School Board, the most important thing we can do is to get our children back to school, and to get them back to school in a safe manner for not only our children, but also for our teachers and administrators. And one of the best ways to do that is to make sure that we have everybody vaccinated. And once we have complete vaccination and reach that herd immunity, the vaccines will be effective. The pandemic will be diminished, and we can safely go make sure that our children are back at school. We have to educate our children. It is critically important that my grandchildren, all of our children here in Kane County and throughout the state of Illinois and throughout the nation, have solid background provided to them and accessibility to full education. So we're going to make every effort we possibly can. And we are, to that point, we are working with our 9 area school districts because they have the largest fleet of buses available here in Kane County, along with Pace Bus, to make sure that there's going to be accessibility to all of our residents so they can come to the site in Batavia to get their vaccines.
Corrine and Michael, thank you both so much from the Kane County Health Department for talking to us. We're excited about March 19th. That's going to be a big date, and of course we will remind all our viewers once the date gets closer about that vaccination site.
We can tell that the county board should be pretty passionate about this. The point of it all is that early on there's a recognition that we had to reach all the audience as possible. I'll just play for you a little bit of a spot that incorporated Congresswoman Lauren Underwood, who covers part of this district, and she's a real cheerleader, of course, early on.
Good morning. Well, the Kane County Health Department telling ABC7 this morning they're keeping a very close eye on the rising COVID-19 rates, as well as the different strains of COVID-19 here in this community as those rates continue to rise. This coming as 75,000 people here in Kane County are now fully vaccinated. This morning, the COVID-19 vaccine rollout continues in Kane County.
We're able to serve a little over 2,000 people each day, and as vaccine supply increases, we're hoping to be able to get even more people served.
This mass vaccination site is located off of Randall Road in Batavia.
We're really excited out here at what we're calling our Kane Vax Hub.
The hub alternating between all three vaccine brands. Officials chose this site because it's close to Elgin and Aurora, helping address racial disparities with the rollout. The Kane County Health Department says as of today, 75,000 people in the county are fully vaccinated.
We want to get vaccine to almost 400,000 people in our community, and the supply just isn't there yet. So this is something that people are going to need to continue to be patient.
The rollout coming as the COVID-19 rates across the state continue to climb. In just the past 10 days, Kankakee and Will counties seen a 27% spike in COVID cases. In Chicago, the test positivity rate topping 4%. And in suburban Cook County, rates up more than 20%. Those numbers could delay the state's move to the bridge phase of reopening. Congresswoman Lauren Underwood toured the site today in Batavia, hopeful this will allow for a faster rollout.
We have been getting so many calls from constituents frustrated that there weren't vaccine appointments available in the 14th congressional districts, and sites like this are a real resource.
We, every step of the way, we're pushing out not just press releases, but contacting the key media partners in the Chicago market with a story idea or this or that. So it was very intentional on our part because we knew we had a big voice. And what we found when we contacted the assignment editors in those various, whether it be MAQ or BBM or certainly LS, ADC7 and Fox, was the fact that it used to be really hard for them to get any information out of Kane County, and actually, in fact, it's several of the collar suburbs. And so the willing partner there was looking for ways to cover their story. Another lesson learned. I'm going to play just one more video real quick here from a doctor. This doctor ran the ICU at Copley Rush.
Everyone who's eligible should get the COVID-19 vaccine. The vaccine is highly effective, very safe. It'll protect you, it'll protect your family, it'll protect your friends, it'll protect the grocery store clerk you come in contact with, the restaurant server, some of whom may have underlying medical conditions you're not aware of. This vaccine has been under development for 10 years in different formats. It's a new technology, but it's been used for other coronaviruses for a while. Most negative effects of the vaccine show up within the first 2 months. We've been given this vaccine for many months globally and a lot in the United States, and we've seen great efficacy and very low risk. Personally, I've had to do a lot of work in our COVID units and even intensive care when our usual hospitalists and intensivists have been overwhelmed. 4 of my long-term patients died from COVID, and a number more have been hospitalized, some of whom have long-term effects still. I myself had COVID, a mild case fortunately, but still not back to full exercise capacity. Because we don't know how long natural immunity lasts, I still got the COVID vaccine, both doses. So I would tell people, even if you've had COVID and believe you have immunity from that, you should still be vaccinated.
That doctor had a pretty serious statement to make. He really broke up after we were finished videotaping. He was just trying to recover his emotions at that point. And he's typical, as you know, of a lot of providers that have been dealing with COVID. I got another video that I'd like to just share with you from we did a lot of videos with Hispanic folks. And we ended up doing a couple of campaigns going after these selected communities. So initially when we looked at the audience, we thought it was, okay, it's going to be fairly simple in terms of how we can target. We know that we've got a demographic and age shift that we've got to address. We've got to address 65 plus, 85 plus, 12 to 65. Yes, we have a large population of Caucasians in the market, 57% or so, when we had a large segment of Hispanics. But within that, we quickly realized we had a chunk of naysayers. We had primarily Caucasian white males, 55 plus or 50 plus, that were flat out refusing to take it. We also had a big chunk of Hispanic folks that didn't trust it, so we knew we had to do some much more targeted campaigns. We ended up recruiting a couple of vets, one who did 3 tours in Afghanistan, and another one who was an Air Force pilot in Vietnam. One was Hispanic, one was Caucasian. We did videos with them. We're not going to show them here, but we did a radio spot, and actually a couple of radio spots with these guys, both of which were speaking, adamantly about getting the vaccine. And they were, I think they were using words that they hoped, we hoped, would resonate with the audiences that we were going after, and it did help. We also did specific on the Hispanic side. There's a large radio station in Aurora that covers most of Chicago very well, and we did we created a radio spot, all Spanish, for that station, and it was just 2 bros talking, and it was rather loose, and again, it was telling a story about why you ought to get your grandmother vaccinated and why I'm doing it myself. I mean, again, telling the story of, avoiding death. I'm going to play.
My name is Casito. My friends call me Casey, for short, Cuevas. And I'm a community activist, and also I love to help my community. I'm part of the Aurora Hispanic Heritage Advisory Board for the city of Aurora. It's very important to get vaccinated. I feel that I am putting what I think is important, inside of me, saying, hey, I believe in this, I believe in science, and I know that this can help my community. So I feel if you get vaccinated, I got vaccinated. I had very mild symptoms, so I didn't feel that, hey, if I get COVID and I see the extreme, how bad people can get, I'd rather get vaccinated and be safe, have mild symptoms, and not have to worry about it.
Our videos played primarily on YouTube, and then we ran we used Facebook, both from an advertising standpoint as well as posting. And so once a week we'd have a fresh video in that regard. So, and then we got a lot of other organizations, and Michael may speak to this in terms of being able to share those videos throughout the county.
Absolutely. So we were trying to keep an eye on national surveys that were going on to see who trusted agents were for different segments. So with the examples we just gave, we saw with that older white population that doctors are still somebody that can be trusted. And again, this is months ago, so I don't know if this changes or not. But then with our specifically with our Spanish-speaking population, we knew that getting into the community and getting community leaders to be the spokespeople, that they didn't need to see somebody from the health department. We were already out there. That message was already going, but we needed somebody that was trusted in a local neighborhood. So as RJ just mentioned, we did a lot of videos with people, again, of all different ages, different races, faith leaders, business leaders, had them talking to their constituents. And then in addition to having the video on YouTube and posting it through our usual social media, as RJ mentioned, we would also work very closely with these organizations to make sure that they were pushing it out to their constituencies. And just a note about the last couple of segments, it's tough for us in being in a larger Chicago market. So in some of the cases, we're trying to find unique ways, of course, that, how do we make our voice heard if we're in this larger market? And in many ways, we're doing the same things that a lot of other health departments are doing. So how do we make that something that gets on the news? So being able to get the extended airtime, it goes Chicago-wide, but it gets the attention of our local residents. And that's harder to do, and we didn't have those relationships prior to this.
So by late May, we hit 395,000 shots given. That's not fully vaccinated. And we started, we were tracking that. And so on a weekly basis, we have a graphic that was posted on the website that just, I'm not partly on both the landing page as well as on Facebook, just telling people, okay, we've reached this plateau. And then we started switching gears and started telling the story of fully vaccinated a little later on. So Facebook campaign that we first launched in May was all focused on parents, okay, grandparents primarily, but with kids in mind. So all the things that you've given up, all the things that you can't do right now, all the things that you wish you could do, were obviously topics that we wanted to capture in these quick little messages. And it all boiled down to this: if you get vaccinated, eventually you're going to be able to participate. You know, you are going to be freer as a kid. You're going to be able to celebrate birthday parties with, family. You're going to be able to just compete. You're going to be able to get out there and, play soccer. It's whatever it might be. The point of it all is that we used this approach of trying to create a little bit of an aspiration here with people and challenging them. And basically we were going after the parents because, they have to take care of getting their kids to get vaccinated. But at this point it was just 12 plus. But there again, we had a lot of older folks that still were reluctant. And one of the ways in which we could remind those older folks that it is imperative that they get vaccinated is because we had lots of parents, and maybe you can speak to this anecdotally, that flat out refused to take their kids to grandparents if the grandparents weren't vaccinated.
Absolutely, and I'm sure we're all living this in our regular lives with our own family and friends. So each person has a unique reason why they may have an opposition to vaccine. So trying to make sure that our messaging, not only that we're using the right spokespeople, but that we're using a variety of messaging. Some people care about the health, some people care about seeing their grandkids. And this isn't done, right? We're still struggling with people out in the community who we're trying to convince, and in some cases even not being able to see their grandkids isn't enough to get them to step forward. So it's something that we just have to continue to gather input from people, and something that we struggle with in our messaging still, and it's national, is how to not just segregate the us versus them, but to try to figure out from this individual's perspective, what is it that's important to them? How do we reach them? As opposed to typical public health thing is, and typical medical thing in many cases, is just, hey, you should stop drinking, you should stop smoking, you should stop eating so much, you should exercise more. We know those things don't work. So how do we get out and reach people with something that is going to have a little more of an impact on what's important to them?
Throughout this whole effort, I think we ended up producing about 53 different pieces of lit. And so we had outreach posters that were going up in grocery stores, in churches, in schools themselves, etc. The focus on schools, of course, was aided because I think all the school districts were really supportive of receiving any kind of messaging that we could provide to them to get out. So we would provide with that, Facebook ads, etc. that they could post, that they could actually distribute and post in their own, I should say, Facebook posts that they could incorporate into the school's Facebook effort. One of the things that we ran into was that, I should say, Kane County's health department ran into was that people tracers were having a hard time getting response from people. People were refusing to pick up the phone to answer a call because it was a strange area code.
Sure. So the piece that's on your right there is something that we really pushed out then to people to say, hey, if you get a phone call from this number, this is the health department trying to reach you. I don't know about all of you. I finally just got rid of my home phone, and I think I'm relatively young, so maybe I'm a little behind in doing that. But when people call, if it's a number I don't know, I don't answer. Typically, I don't answer if it's a number I do know too. But trying to reach people by phone, especially younger people, when we started to see cases go up, younger people really don't want to answer the phone. So trying to get a message out to say, hey, if you see something from this number, that means that we're trying to reach you, and this is really critical that you answer. So at least people have that information. They still get to make their own choice, but we did see an increase in compliance with people being receptive to answering our calls, which is very important for our contact tracing.
So both of these little examples, school posters and phone cards, are old school, but they work. And you can, produce them. Obviously, we would design the artwork. We would design to take care of the messaging. Kane County would take care of the printing and the distribution. The distribution is most important because we wanted to get the message in the right hands with the right folks.
And I should add, we had that core group of community partners that we worked with. So we would test all of this messaging with them. So when we would have a Spanish piece that was going out, we had community members that would review it, that would give us tips on different words, or maybe you should phrase this a little bit differently, so that we knew it was going to be appropriate for the audience, which you're all professionals, at least in the public health world. That's something we say all the time is important, but we very rarely do it. So it was really rewarding in this whole process for us to be able to actually have that input the whole time, to know that our message was resonating.
Yeah, this wasn't just coming out of TAG. This was because we got informed information. So one of the other things that we did was participate, the Kane County folks participated in a statewide thing. So by June and July, everybody was talking up the need for incentives. We kind of hit a wall, so to speak, in terms of getting more people vaccinated on a rapid basis. And so there were all kinds of things tossed around. We were hit up one day with an idea that came to Kane County to hire a TikTok sensation, and she wanted $25,000 for showing up at one high school, and we figured that we definitely fill the gym of 5,000, but the 25,000 price tag was a little steep, so didn't do that. Instead, one of the things that went on was to participate in you can maybe speak to this more specifically, a Six Flags tie-in promotion with parents and kids.
Absolutely, and there was a lot of discussion around this, around the state, around the country. Is it right to incentivize, hey, I got my shot a year ago, why do we have to give somebody a prize to do what they should have done? All of that kind of talk. You see, I know they had shots for shots up in some bars in Wisconsin, we'd see in the news, things like that. Six Flags donated to local health departments tickets. We were able to go, and we had the lottery in Illinois, but with this campaign, we were very successful at then targeting specific schools, specific high-need schools where we could see in the community that there was lower vaccination rates and where there was higher cases of illness. And we could go in and say, hey, bring your family in. We're going to give you several tickets to get vaccinated. So even though that's an ongoing debate about how to incentivize people for these kind of things, it is effective at getting people in the door in some cases. So
we obviously, throughout our efforts with Facebook posts, paid a lot of attention to facts front and center, and we tried to use community influencers. We used clergy for that purpose. We had a number of African American clergy, we had Hispanic priests, and this is just one example of a Methodist minister. But the point of it all is that we were, again, I think what Kane County was doing was just really diving deep into engaging the community, every aspects of the community, to help influence others to get vaccinated, and to use people that, these aren't stars, these are just people that local people, many people would know, and they were trusted. So PACE is the big metro link service in the suburbs. Perhaps you're already familiar with that, but they came through and proposed that they would help us with this effort. Initially, they were selling advertising on the buses and different things like that. And so we decided to take a look at this opportunity, and that was to target Hispanic areas within the county by going and using bus shelters and creating messaging for the bus shelters. We had, Spanish as well as English, and we ended up with 10 different bus shelters. We're going right, obviously, to the heart of one key audience, and the campaign lasted for over 60 days, actually, in terms of exposure. And it seemed to, based on the numbers, okay, when you look at the numbers of vaccination were acquired by this particular segment or community, I'm talking about Latinx and Spanish folks, the numbers have been growing.
Absolutely, and this also is more aspirational messaging that we used for this one to make it more positive for people, really focusing on family as well. And then I don't think we've mentioned that a lot of the feedback we received from community members who were hesitant to get vaccine, there was always a myth or two that I shouldn't say there always, in many cases there's a myth or two that people were hanging on to. So as RJ has shown through several of these slides, we took those myths and just tried to push back on them, but again, not in an overly forceful way, but just kind of keeping it in front of people to say, this isn't impacting your fertility, this isn't changing your DNA, but just to keep that positive truth message out there that may counter some of the things that they're engaging in. And in the Spanish language radio ad that we did, that as RJ said, it was two guys talking about getting his grandma in to get vaccinated, and it was really loose, and they just went through about 4 or 5 different myths that are pretty common, but it's buried in the conversation. So we were pretty happy with it, and again, we've seen a pretty good uptick in vaccines after that.
Yeah, one of those myths that we raised up was the fact that you were getting implanted, and the government was going to track you down. So we had the opportunity to deal with some of those head on. But I think the key point here with a lot of this messaging is it became much more family focused over time. Then again, very much of a ground game here. Did flyers for clinics so that the clinic could take this basic flyer, we put different messaging on them, but then they could write notes and stick it up on the door or whatever it might be. The other thing is real basic, again, this is a ground game, but the county wanted a branded piece that they could push out everywhere that caused people to think about entering whatever it might be, school, county office building, church, whatever. Just raising the question, don't enter if you're sick. And then some real basic facts. Again, speaking directly to folks. And this is the kind of thing that you can't do by sending it out. You do it because you've got a ground game going with all kinds of, like Michael said, you've got a community coalition here of people that are supporting this effort, and they provide the horsepower. So by August, we had 276,000 fully vaccinated. This was towards the tail end of our assignment. We continued with Facebook posting, and again, some basic community marketing efforts that the county has continued. So one thought we had back in end of July and August, early August, was to do a TikTok campaign. We thought we were going to be really bleeding edge on this, okay? And so we came up with this idea that we would basically promote on TikTok, participating in a campaign. You could win $100 if you were one of 3 videos that won. And we had a judging group and everything else. The whole idea was to stimulate, hopefully, interest on the part of kids to do a video that would, promote the idea of getting vaccinated. Okay, so we got ready. Then all of a sudden, we hear about these various videos that are sweeping across the country, encouraging kids to go in direct to high schools, or whatever it might be, okay? So at this point, pulled back. And the reason I included this comment here and included the poster was just that, you get into a situation like this where you're scrambling to come up with good messaging that's going to be impactful, and you're using earned media over here to push things out. You're using some paid media, and you're using a ground game that's going to continue to push out messaging, whether it be on posters, etc. And you come up with a message that, oh wow, this is going to really strike hard, right? And you got to realize that you got to pull back and evaluate it, because there's ramifications. And this is one clear example of that. We could have rushed into this thing and we would have probably gotten into a firestorm, because Michael and his whole staff has had to deal with all of these various counter thoughts to getting vaccinated, etc., and also the negative requests for we're not that accessible to you, etc. Because they're actually executing the ground game, they're right out front. And maybe you could talk a little bit about making decisions when it comes to messaging.
Yeah, we really run our hands about this, because it is exciting to use new technology that a lot of people are using. There's a lot of content already out there, pro and against, on TikTok. Giving the youth an opportunity to get engaged, that's a proven strategy that works. I have a son who has a 2 million view video on TikTok, so I'm a little familiar with it. But the opposition is extremely organized. We have cases going to the Illinois Supreme Court about different things that have happened over the last year, where Kane County is named. We had to call in additional police forces to our courthouse a couple of weeks ago because the teachers were protesting and school staff were protesting the new vaccine mandate, and it was getting so out of hand that we had to call in additional law enforcement for one of our key partners that we work with on a daily basis. And with social media, it's just always that double-edged sword. And so in ongoing discussion, we had this ready to go to launch. We were excited to see what the young people came up with. But like RJ said, sometimes it's just not the right thing to do. So we opted to step back.
So I'd like to wind up with one short video, but before we get there, we've been talking all this time. We haven't engaged you. If we have a few minutes, I'd like to hear, and Michael would too, maybe some of your own experiences in dealing with COVID communications in your own areas.
I have a question. So I am from a very small community, town of like 3,000. So our vaccination rate is terribly low, not because people don't feel like they can access it, but because they don't believe in it, the politicalization and all of that. So I guess I have two questions. I'm partly just curious if you have any more feedback from me on that, or just any other suggestions. And then also when you were talking about like getting out into like certain organizations and trying to bring the vaccine clinics to organizations, have you run into issues with people not following up to get their second dose? Is that something like, it's not like you can just push the message out and get people vaccinated and then they're done? Sure. It seems like that's kind of a barrier for us too, that people don't come back and do the second one.
Absolutely, and there's probably another hour session embedded in those questions, right? So in terms of the simple one with second doses, we're at about 81% have had at least one dose. We're around 62% have had 2 doses. Some people are in the process to get their second dose, so they're still not off schedule yet. But many people did just get 1 dose and they said, that's it, that's all I'm going to do. And also, I think an additional barrier is when we say, hey, get vaccinated and you can quit wearing your mask and do things like that, and then you turn around and we say, okay, hey, things have changed, because things have changed. But people point to us, and including my own friends and family, are like, hey man, I didn't want to get vaccinated. You convinced me because you told me we'd go back to normal. So all our messaging has to be kind of this common sense, hey, we're all in this together. Things are going to continue to evolve, which that's really hard to message when you're trying to craft simple messaging. And then for the harder to reach populations, this is a struggle everywhere. Certainly it still is in Kane County, but it's finding those trusted people. And we've had luck with clubs, with groups. This is more for younger people, but sports teams, if we can get them to go in and get vaccinated together, we've had success with that. But if you can do something through a Rotary or through a Kiwanis where you can, and it's the regular old community organizing type of things, but with this, how can you find somebody that can get a couple people to join them? And this is unique that we have, households that are completely split on this issue and people fighting all over the place. So it's really hard, but those are the types of things that we've been trying. And did you have one more part of that? I'm sorry.
I guess my only other question was, I kind of missed it. What was the issue with doing a TikTok contest? I heard you say something about school, but what was the exact issue with that? So
we were just nervous because the opposition to vaccines is so strong and so much more organized in terms of people who get a vaccine. They're not necessarily as likely to go to rallies and things like that. And young people are very creative. As RJ mentioned, let's see, there's the vandalizing schools trend.
Them at risk type thing?
Yes.
Okay.
Yes, and slap a teacher and all this kind of, and again, that's a last week and it's new, and again, I don't know how real these things are. I mean, there is a teacher who was hospitalized because a child struck them and they posted it. So we're just like, oh, wait a minute, do we want to put young people in this position where there's organized opposition that kids are hearing at home all the time? And it's that double-edged nature of social media. It's awesome, and it's like can be the worst thing ever. So that's why we pulled back.
Any other comments?
Yeah. So what about the hospital's role in all this? I mean, I think that I don't know that that's fair to say. This is your job, right? It's the health department's job. We have a voice and we need to, but it's not our full-time day job. So what role did they play in this with you?
Yeah, great question. So we have 5 hospitals in Kane County that are from 4 different larger systems, Rush and Amita, and we have Northwestern and Advocate Aurora. So we have different strategies that they all identified as their role. So we had hospitals that were standing up clinics and running patients through from the beginning, as soon as we were able to get to the public. We had other hospitals that said, we're not going to do that. We don't have capacity to do that, but we're going to send nurses to your clinics to help you. So they did that. And then we had others that said, well, we don't have the capacity to do that either. So we're just going to help with the messaging, and later down the road, when there's enough vaccine availability, we're going to give it to our docs and we can administer it in our clinics. So even with just a sample of 5, which is really just 4 health systems, we had 4 different strategies for what the role of the hospital was. Now, of course, we work with our hospitals on a daily basis where we're tracking census, we're talking strategy and things like that. But it's not one role. I think it's really self-defined for them.
I think, though, that what I saw from the outside at the outset of our engagement was that the county was taking a lead here. They had great relationships with the health systems, obviously, in the county, but they were taking the lead in terms of helping to execute and then working out individual strategies. So that it was complementary, a partnership, so to speak.
But it's another challenge with big systems and communication at the, if I call it county micro level, because it's not the same, and that, right, we're all growing through that over the last decade or so, like, okay, I used to have a CEO who was here and all their staff were here, and now we've got corporate employees who have coverage, and so for our messaging and things, that's something I think we still work through.
What was your budget, and was it part of your normal expenditures, or did you get grants or government help for hospital help?
We did get, we received input from the hospitals, certainly, and support along the way in terms of technical assistance and physicians who were made available, spokespeople, et cetera. Our budget for this was about $85,000. So considering how big the scope of it was, I think it was a pretty small budget. And of course, we've been getting different federal grants and things that have been coming in. But we really focused on earned media in most of this.
So I guess my question is more of kind of like, okay, if this all happened in the beginning, here we are today. What advice do you have moving forward? Because I'm from like the very southern part of the state, and it's extremely politicized, and we have very low vaccine numbers. And so we did a community vaccine clinic in one of our towns that had about a population of 5,000 in the whole county. But we did flu and COVID. We did it 7 a.m. to 6 p.m., trying to get some of these teachers, trying to get some of these working folks. We did not have anybody that wasn't retired show up. We had only vaccinated 30 people, and of those 30 people, only 10 of them were Pfizer boosters, 2 first doses, and the rest were flu shots. I feel like we're hitting a brick wall. Like, those that are going to get vaccinated have done it. And those that aren't going to get it, aren't going to get it. So I'm just trying to figure out how to, I guess, maybe try to move past that, gain some additional momentum. Like, what suggestions do you have?
Yeah, that's a really good question. We're stuck in the same spot, right?
No, we are, yeah, and it really gets down to patience, okay? But the other thing is you're really dependent upon family members, who've gotten vaccinated to influence the non-vaccinated family members, because at that point in time, people have made up their mind, and they constantly get it reinforced when they listen to or see messaging that helps reinforce that belief, right? Mm-hmm. And the only way that we know right now to be able to counter that is obviously through very, very personal. And it's not like you can put flyers out and this and this and that. It really gets down to having a group of persuaders, but getting people inside a family to be able to influence other family members. And I know that's tedious as heck.
Well, and it's tough. I mean, I'm fully vaccinated, and my husband is not, and is totally against it. So, like, we don't talk about what I do for a living, like we're no longer having these conversations.
Now, one of the things that I've noticed in counties that are near where I live, out in the western part of the state, in Rock Island County, across the river we got Scott County. not been around, is the fact that hospitalizations, and I'm sure it's similar up here, but hospitalizations for COVID are 95% because people that weren't vaccinated. And then the deaths are even more, I mean, in terms of, the percentage of people who died because of that. I mean, so it's a matter of just time.
Yeah, okay.
And I think something I said, I have a mother-in-law who is not vaccinated, and we have a large family where typically we have 50 people at my house for Christmas Eve that we host. So we're having those discussions of what do we do this year? Because I don't really want everybody to be around if everybody's not vaccinated. And that's really hard. And I think, how do we, and this I'm editorializing now, but people may have irrational beliefs about vaccine, but those are their strongly held beliefs. And we finally got my father-in-law vaccinated just within the last month. And my mother-in-law, who is a smart, sensible person, was in tears because she thinks that now he's going to be at more risk because of where she's consuming her news and her information. So she's wrong with all the facts, but that's her deep held belief. So I think when we're talking to people, it's especially on more of a macro level, and I agree with RJ, this is getting down to individual conversations. And as we all know, it's like your story is not uncommon, where it's even people within our own households who are really entrenched. It's how do you not just us versus them it and move it along? Because I don't know examples of, where the stick is the most effective way to get people to change their mind, right? That rarely works, even though it's our favorite thing to go to first. So it's how do we bring people along? Hospitals are full of people who are unvaccinated. But the unvaccinated people know that. They see the news. They know that. They may not believe it, but so it's I mean, in both cases with all of our communities, it just continues to be such a struggle.
Okay, we're out of time, but I've got one last short video that speaks directly to this question that you just asked.
We've lost about a total of 10 to 12 family members, both like extended family members because of COVID, for the people who are just unwilling to compromise, unwilling to think of others, unwilling to do the research and read the cited and peer-reviewed science. I'll take you to go see my dad. We'll go see my dad and my grandmother and my aunt. They're all buried in the same place. Their stones are freshly carved with their names and dates. We'll go talk to them.
That's it. Thank you for your time. Hope you got something out of it.